Hello. I wanted to do my practice analysis paper and oral presentation on epidurals. I was able to see 2 epidurals placed during my labor and delivery clinicals, and I thought it was really interesting. And I know that we as nurses don't place the epidurals. It's usually an anesthesiologist or a CRNA. But I think that it's important for us as nurses to understand as much as we can about epidurals so that we can keep our patient educated and involved in the decision-making process throughout the entire thing. And I also think it's important for us to know generally what's going on in our patients' bodies and what we need to know in terms of adverse side effects to look out for and how we can best ensure the comfort of our patients. So, like I said, I was able to see 2 epidurals placed. And the first epidural was placed in a mom that was kind of just ready for the epidural to be placed whenever. She didn't really have a preference as to when it was placed. She just knew that the anesthesiologist was ready and available. And so she's like, okay, let's just do it right now. And it was more of like a convenience, like the anesthesiologist is ready, let's do it. The second mom was a bit more purposeful in her placement and timing of the placement of the epidural. So throughout the entire length of her stay, we were just consistently checking in and making sure she wanted the epidural and making sure we were ready for when she wanted it. And something that I really liked about my nurse is she was very consistent about keeping her patient or our patient involved in every decision-making milestone and how that would affect the epidural placement. So for example, we would go into the patient's room and we would say, okay, you are at this many centimeters dilated. We're thinking of starting Pitocin. Would you like your epidural now? And we made sure the mom wanted the epidural before we said, would you want your epidural now? But the mom wanted the epidural, so we said, would you like your epidural now? And she said, no, I want to wait a little bit longer. I want to keep my mobility for as long as possible. And so then we came back later after her contractions had increased, and we said, okay, we're going to titrate your oxytocin up a little bit more. Would you like your epidural now? And our patient said, no, I'd still like to wait. I would like to have my mobility as long as possible. So then later, before it was time to artificially break her water, we said, okay, we've titrated your Pitocin up. Now we're waiting to have your water broken. Would you like your epidural now? And the mom said, yes, I would like my epidural now. So again, I really loved how my nurse was really consistent with keeping our patient involved in the decision-making process, because I could tell that our patient felt really confident in her decision-making and just her role in her own labor. Because sometimes I think it's easy for us to take control and say, no, we know what's best for the patient, but ultimately the patient knows their body best and knows when the epidural would be best for them. So because of this entire process of the mom deciding when the best time for her epidural was, I was curious if the timing of an epidural made a difference on the entire process of labor, if it shortens it or lengthens it, or if it causes extra harm to the mom or baby or anything like that. I just wanted to know generally more about the epidural process. So that started with me getting more background on epidurals. And so I found an article from PubMed that was released in 2022, and it was just like a general overview of how epidurals work. So an epidural is usually placed in the lumbar, and it is placed using a specific needle and syringe. And the syringe that's used is really sensitive to resistance. And so this needle is threaded into the mom's back, And it's really important for them to keep a very wide back, to stay arched like this, shoulder down, so that the anesthesiologist can have a very clear view of where the needle needs to be placed. When they're placing the needle, they're really being mindful of the resistance and how it's affecting the liquid within the syringe, which is the medication. They're advancing it millimeter by millimeter, and once they feel that lack of resistance, then they know that they've entered this epidural space, which is a third space, and they know that they're able to finally administer this medication that will cause the analgesia, the pain block for the mother. And this pain is blocking nerve transmission from the uterus and birth canal, so it can significantly decrease the pain that's felt during the labor process. But also what I learned from this article are side effects that we should look out for our patient. So because it's a lot of times the epidural contains an opioid, the mom can experience nausea and vomiting and urinary retention. So it's important for us to be aware of those things and to ensure the comfort of our mom, to place a catheter, to have nausea medication if it's indicated, and things like that. It's also important for us to consistently rotate mom so that the medicine doesn't settle into one side or the other. And we also know that this epidural can cause a lack of mobility, and that is something that in certain moms can decrease or can lengthen the labor time, because mobility is really important, just depending on the mom's body, in progressing contractions. And so some of them want to wait, some moms and patients want to wait until the last minute to receive, and they want to wait as long as possible to receive their epidural so that they can continue with their mobility and keep their labor process moving along as they would like, in the time frame that they would like. And that was how the second mom was, is that's why she was so specific about when she wanted her epidural placed. And so I used Cochrane Library to find a systematic review of information that would explain if the timing of the epidural affects the labor process significantly. And from what I found from that information, there is no significant difference in the timing of the epidural placement on the birthing process. So it used to be debated that an early epidural increases the likelihood of a cesarean birth, but based off recent research, that is no longer the case. There's no increased risk. It can sometimes slightly, sometimes giving a little later, or an epidural can sometimes lengthen the birthing process, which is what I talked about briefly, because it can lessen mobility, but that just depends. It's a case-to-case situation. But overall, just to sum up all this information, it's important for us to be aware of things that can go wrong in our patients when they're receiving an epidural, and also be aware of things that can go right. Like if an epidural is working correctly, the mom will lose mobility and will lose feeling in her legs. And what do we do with that? We rotate her so that she can have even loss or even numbness on both sides. We make sure that she's comfortable. We also make sure she has catheter in. And because there's no significant difference in the timing of the epidural and how that affects labor, we make sure that the mother is involved throughout the entire process, that she has her autonomy throughout the entire thing, and that she feels confident in her decision-making during her labor process, and that we support her in that. So that was what I learned. And yeah, thank you for listening.